Okay. Good afternoon. Good afternoon. Thank you. Thank you. We're raring to go. It's heartwarming to see so many people here ready for this discussion that really hits home. I'm Ruth Gaynor. I'm here to welcome you on behalf of the Jewel Cobb Action Coalition. Great. Dr. Jewel Plummer Cobb frequented this historic hall as a student, distinguished scientist, career cancer researcher, and educator who worked tirelessly for a just, equitable, and inclusive society. The Jewel Cobb Action Coalition is working for Dr. Cobb's goals. Our current focus is affordable housing, and especially workforce housing for Falmouth. We knew even before the official publication date that we had to bring Tracy Kidder and Jim O'Connell to Falmouth to discuss rough sleepers. Our reasons were, first, because we had learned shocking numbers and terrible stories of people and families in our midst without any home. And second, because the profound experience of reading Mountains Beyond Mountains by Tracy Kidder was still with us. How many of you have read Mountains Beyond Mountains? So, like us, you knew, as we knew, that rough sleepers about another doctor with his mission would bring inspiration and insight for tackling the surprising conditions that exist, so ironically, right here. Helen Molina put us in touch with Alisa Magnotta of the Cape Cod Housing Assistance Corporation. Dr. Nipam Patel, director of MBL, immediately gave permission to use this hallowed space. Since January, we have had the expertise of HAC's Patty Mitro-Costas and Catherine Clark. Gina Hebert and Kerry Mills of MBL have been helpful and encouraging. JCAC's Sandra Gifford, Sandra's here somewhere, has been indefatigable. Thank you all so much. Sadly, the most committed and dedicated supporter of the cause for which we are here, helping individuals who find themselves homeless, Michael Zygmunt, passed away less than a month ago. Michael is greatly missed by all in the Jewel Cobb Action Coalition and Hal and me personally. And we're so glad that Naomi Zygmunt could join us today. We're very pleased also that State Representative Carol Doherty from the 3rd Bristol District and State Representative James Hawkins from the 2nd Bristol District are with us also. Good. Now it is my pleasure and honor to introduce Alisa Magnotta, the CEO of Housing Assistance Cape Cod. Alisa has been CEO of Housing Assistance for over 7 years. Her 25-year-plus career in nonprofit leadership includes 4.5 years as the COO at Gosnold and the Executive Director of Alzheimer's Services of Cape Cod and the Islands. She is a fierce advocate for affordable housing and for the care and sheltering of our most vulnerable and disenfranchised. Welcome, Alisa. Thank you.
Let's see if this mic is working. Is my mic working, or should I use the, are we good now? Okay. Thank you, Ms. Gaynor. I appreciate it very much. And louder? Okay, can we do a mic? Well, I've got this mic and that mic, so I'm trying to they're trying to adjust my mic as I'm talking here. So do you want me to keep using, is this one good now? Yeah? Better? Yeah. Everyone can hear me? Oh, no, we're still on a no over here. So I'm going to keep talking until we can get my mic level set. Better? Yes? Okay. All right, so first I want to say welcome and say thank you. It is truly an honor for us to have been part of your vision to include us. Back in our office in Hyannis, we dream of having these kind of events every day where people come together, like-minded housing advocates come together to talk about the needs of our society, of our population, and those we love and care about to be able to remain living on Cape Cod. And so when we were invited to be part of this event where we have a literal rock star in the housing world, Dr. O'Connell, and another rock star right in the literary world, Tracy Kidder, we were so honored to be elevated to this platform. So again, thank you for welcoming us. Thank you for having us. It's so nice to see so many people in one place on Cape Cod, which this is a big deal. This is a big deal, and it's a big deal because it's also a testament to our partnerships, our donors, our good work that we do that we're usually out front and center on, but there are a lot of layers and a lot of people behind the scenes. So the significance of our mission and you all being here is a testament to the importance of it in our communities. And so as we read, right, Rough Sleepers, everybody in here read it, I read it twice, we realized that there's not one person or one organization that's going to change the outcome of homelessness or of the housing crisis. That this is a societal issue that needs to be addressed by each of us through social justice initiatives and systemic change of policies at the federal level, the state level, the county level, and in every single town on Cape Cod. But for me, this book, the thing about this book that I loved the most was that you've got a little bit of, it's about seeing. It's about seeing the people. You got a little slice of what my colleagues in the outreach world and from Duffy and Catholic Social Services, who you'll hear from soon, see every single day. And you got to see that these are real people. They have real stories. And oftentimes they ended up in the situation and circumstance that they're in because of horrible situations and circumstances that they fell into just because of where they were born and the situation they were born into. Right, so sometimes it's messy and it's complicated to see how people express themselves as human beings. And we sometimes can have a judgment or an error about that gives us this notion to push them away or to step over them and look the other way. And what we love about Dr. Jim, right, is that he cleans their feet. He sits by them and hears their stories and knows their names and knows their families and knows everything about them intimately. And you start to see, again, these are people that we're talking about. And the policies that impact the people that we make, the policies and the rules we make, are hurting our people. So hopefully we'll get into solutions and lessons. The next hour is going to go very fast. So we're going to start by inviting our esteemed guests up. Then I'm going to turn to our local experts and ask them to come up. And then we will open it up for questions. So without further ado, please join me in welcoming our esteemed guests, Pulitzer Prize winning author Tracy Kidder and Dr. Jim O'Connell.
Before I call down.
Yes, sit down. So let's just do a mic check before we get started because we want to make sure the levels are okay.
Is this good? Is that all right?
Can everybody hear?
Can you hear? Okay.
Tracy and Dr. Jim. Dr. Jim, can we hear you?
Can you hear me as well?
Yes.
Well, I'm hoping you can't, but
Okay, good. We got that cleared up. We got the technical stuff cleared up. So first, let me be the first to welcome you.
Thank you.
This really is a big deal for Cape Cod to see this many people in one place, right? So maybe Woods Hole, it happens more frequently than Orleans, where I'm from, but this is a crowd. We're very excited that you're here. So, and my team here is very excited to meet you and talk to you. In our discussion about the book, there were a couple themes that popped out or that I read consistently throughout the book, and it was about perseverance. Remember the story about pushing the rock up the hill, right? That you gotta like pushing the rock up the hill. You gotta have perseverance if you're gonna be in this business. And you have to have acceptance, right? Because much of the outcome you have no control over, but you have to keep being willing to show up for it. And so that's the third, is the consistency, right? Perseverance, acceptance, and consistency. And we talk a lot about that in the staff of having those boundaries and those guidelines. So I first want to start with you, Tracy, and talk to us about what hooked you on the story. Was it this contrast of like, you got to keep showing up, but it's really hard? Was it the human plight? Like, how did you get
It wasn't
hooked?
any of those things to start with. I just happened to go out with a previous victim. Another guy I was writing about who was interested in homelessness in Boston and had been told he had to go see Jim. And we went out on a ride on their outreach van. And I was astonished and charmed and kind of appalled too. It was a world, living in a hidden world in plain sight. And I was, first of all, most interested in the relations between this Harvard-educated doctor and people who were, some of whom were arguing with statues in parks, and many of whom were just regular old people, funny, some of them, charming, others. I had never had much experience with homeless people. Like most Americans, I think I'd figured out ways of not noticing them. So I came back later to see if these first impressions held, and they did indeed. And in fact, one of my strongest memories of all of that time was where my book begins, with going to the loading dock where there was a pile of blankets, and having first the driver of the van talk to them and be answered rudely, and then having Jim identify himself and have them explode. Dr. Jim! He went on in his own vernacular. But just to say one more thing about that, I think that, as my wife has pointed out to me, many of Americans, one of the problems is a lot of homeless people don't, most of them, certainly rough sleepers, don't have the resources to, for instance, make themselves look presentable, clean, because Boston has almost no public bathrooms. And that kind of deficit, and there are plenty of others, can make people seem intractably primitive, or even alien. But you can't sustain that kind of feeling once you get to know these people. Then you realize, of course, that they're every bit as human as you and I, and maybe in some ways a little more interesting.
More colorful.
I don't know. I became quite fascinated, and I'm glad I stuck it out.
Yeah, for a long time.
Yeah.
You kept coming back.
I was in total maybe 5 years, but it was parts of 5 years. There were a couple of years where it was just about every day and night. I mean, when Jim was out at night.
And so, how did you feel, Dr. Jim, to have somebody interested in your story when, on one hand, as Barbara McGinnis said to you, just do your job, just be a doctor and just do your job, just show up and do your job. And now you have someone who's like trying to shine a light on it and help you tell the story, yours and the plight of so many that you serve.
I had complicated reactions, as Tracy knows well. So at first, I couldn't believe Tracy was interested in what we were doing, because I knew Paul Farmer. I loved Mountains Beyond Mountains, and that was a magnificent international life. And as Paul used to remind me I was the poor doctor that never got more than a mile from medical school. And he did this very sweetly, but at first I was kind of took some umbrage at it. But and so I kept thinking our story is kind of muted and narrow. But as Paul would always point out at the end of everything, we see inside that mile from medical school just about everything he was seeing in Haiti and Rwanda and Peru, the same appalling disparities. So we struggled with, did I lose my mic here?
No, you're still on.
I'm okay. So we struggled with, one about, this is Tracy Kidder, my God, this is wonderful. On the other hand, we all lead, all of you who do the hour, it's kind of an intimate setting. And do you really want to bring someone from the outside in who might be writing about them and us? And we had a lot of discussions. We had on our board of directors, we have many homeless people, and they sort of beat us up for doubting it. They said, if someone wants to come and tell our story, please let them do it. So Tracy came and, all of our doubts were pretty well assuaged when we realized that Tracy was just part of the team. And pretty soon, I don't think most of our team knew he was even there, or didn't think of him as anything other than another member of the team. And the folks that we were taking care of were, almost to the person, honored and anxious to tell their stories. And of course, Tracy took hours and hours of time talking to people who were really willing to share stuff.
And it's hard for people to share in those situations sometimes. They really, they have some real trauma, right? And so you're opening that back up, and they have some life circumstances that don't look normal to other people. We're always very careful about that, of like, whose story is it to tell? So did you get into that, and when you were writing the book, of like, whose story are we telling?
Me? No, I don't. I usually don't worry about that, honestly. If people are willing to talk to me,
yeah, great.
I try not to. I don't sneak up on them. I try to make sure that they know what I'm doing, but I do try to be a good guest in their lives, and I try to get it right. I didn't find. There were some people, of course, who didn't want to talk to me, but there were most of the people I really did, and were. I don't know. They were happy to have someone listening. There were a few who were extremely happy, like the guy I called Tony. I must have 2,000 hours of recordings of
Tony.
Yeah. I usually like to take notes, but he talked so fast I couldn't do it.
Can I just put an exclamation point on that? What Tracy did when the book finally came out, he gave a copy to every one of the homeless people that he had spent time with. And I was still anxious to know how was everybody, what's the result of all that. And what was hilarious to us, and also very touching, was the only people who were upset in any way at all were those who didn't get in the book. And so
that sounds like human nature. That sounds.
Let us know,
What about me? Yeah.
I'm really sorry about that, actually, but
Well, it's maybe part 2.
I don't know.
Maybe not. So go to the first time you were in the van, and took the ride in the van, and walk us through your feelings. Were you afraid? Because sometimes fear comes up for people. Like, how were you feeling? What was it like?
I was not afraid, because I've done this a number of times. I was never afraid with Paul Farmer. And I knew very quickly, just from the reactions of the patients Jim was seeing, that I had nothing to worry about. I borrowed popularity, and safety. So I really wasn't afraid. I was just interested, and it was just a first experience. So it's hard for me to remember exactly. I do remember some of the people quite well. Most of them are dead now, and that's a somber fact that I might just digress for a second on in Boston.
Yep.
These stats are in my book, but just to remind you that people who live in the shelters most of the time, homeless people, die at 4 times the rate of their counterparts in the general population. Rough sleepers died somewhere between 12 and 14 times that number. So we're dealing with a truly lethal condition. On the other hand, there were, I don't want to say, some of these people were just wonderfully tough and hard not to admire in some ways. Jim, say something.
Yeah. No, I completely. I was thinking as you were asking the question, though, that I think one of the things that I've also been on borrowed popularity because we had the advantage of we get to know people living on the streets of Boston. As many of you may know, there's a van that excuse me, that goes out every night from 9 o'clock at night till 5 in the morning. Two vans now, right? And since an outbreak of deaths, and they're funded, from various sources. But Pine Street Inn runs them, and the people that are on the van, who we ride with, and I've been riding, at least I did for years, 2 nights a week on the van. They're the people that are the real heroes of the story. Just like I'm sure whoever your outreach workers are and stuff, they're the people that really know the streets and know that. And so the work we get to do is really sitting on the shoulders of those people who really do the work. And so I have the same feeling. I've been out on the van for 38 years, and I can only remember maybe once when I felt nervous or scared.
Yeah.
And it's just something about there's a respect out there, a community acceptance of the van. And I attribute that most of what we've been able to do is because this is all done by a team, as I'm sure all of you do here, by collaborations, by teams. It's one of the reasons I feel awkward being up here at the same time,
Yeah, which is one of the reasons why I asked my partners and my colleagues to come, because the same thing, I'm not on the street, my colleagues are, and so we're gonna make sure to celebrate them and bring them up, and Heidi and Susan. So, we have, it's a community. It's a hard population, and we kind of, we all have our role.
You have to know that Heidi and I have been working together for 25 or 30 years, whatever it is. So don't
Yeah,
want to
well,
say
I'm
that.
excited to get her up here too, because I know they all have stories.
And Heidi, right behind you is Dr. David Campbell, who is a real good old friend of mine, who is the best vascular surgeon in the country, and I think retired down here now. I'm not sure, but David, great to see you.
And so talking more about the people, because I know, Tony Colombo, he was one of many, right? He's one, we know that, right? So other people that stand out in your mind that the audience may want to hear their story of.
Well, I saw one of them last night, a guy named John Catrone. He seems fine, actually. John has had a problem with doctors. He tended not to like them at first. Every so often he'd warm up to one. But usually he didn't like them, and he wouldn't stick around if the doctor came late for the appointment. He would just go. But he likes his kidney doctor. And this is a big thing. He said, yeah, she's a good doctor. He told me last night. Anyway, who else? I don't know. If you catch me at a loss.
Well, no, it's okay, Dr. Jim.
I mean, don't get me started here.
It's just so many. I'm sorry. It's just
the man that we saw last night, who has been on the streets, he lived under a dumpster not far from the Brigham Women's Hospital for almost 30 years, and then got housed. And so for all of you, as we talk about housing, housing is really a miracle for many people. We'd add often it's housing with a lot of support, but housing is the entryway to that miracle. And he got housed, and I would have bet $1 million he would never make it. He was solitary, grumpy, didn't really talk well to people, right?
There's a really important story to that, though. He got housed twice. The first was an SRO. He said to me, and John had a long-standing heroin habit that was really pretty perilous. And he said, I don't know why when they put me inside that I didn't kill myself. I didn't. He said just by taking too many drugs. And he finally kind of just left that place because there were people yelling outside. It wasn't a well-managed building. It was one of the street team's people who kind of got him to go to detox. Yeah. He went to detox once, and that was it, which is extraordinary. Wow. But he had really scared himself, I think. Right. Anyway.
No, and then he was, just to finish that story, he was placed in a really wonderful building for older homeless people, the 55 and older crew, managed by this wonderful program named Hearth in Boston. And he is thriving in that setting. He helps, he does the shopping for some of the older women. He's always helping people outside. So it's really kind of wonderful to watch him blossom.
Allowed him to flourish
And
and blossom.
he talks to us now. He was glad to see Tracy last night.
But I guess the point about this is that housing is absolutely essential, but it's not sufficient in many cases. Maybe it would be in the vast majority. After all, homelessness is complicated in every sense, right? It's Jim likes to, I'm just parroting Jim here, but it's especially complicated in the composition of those who are homeless. Most people are homeless only for a day in this country. Those people with proper housing,
They're going to be
they're
fine.
just going to be fine
Right.
without a great deal of help. If you go to Boston's rough sleepers, though, if you put them in the wrong place, they're going to do very badly.
Yeah.
And there's plenty of evidence of that, right? Jim, I mean,
Oh, yeah.
one of the things we have to remember is that in a city like Boston, in any case, there's a famous study about T-stops, transit stops, subway stops, that show that if you go from a pretty fancy area, like Charles Street Station, to a very poor area, Mattapan, you shed something on the order of 30 years of life expectancy. So where you're housed and the kind of housing that you have is also very, very important. So you not only have to have good, affordable housing that's properly sited, decent housing, and then you also sometimes need a lot of support.
The support services are key on the housing first model, right there, where it's get people housed without judgment or discriminating whether they're using drugs or alcohol or mental health. Just get them housed and then deal with the social services and the support services after. It's complicated, right? It's like, it's a good idea, but if you don't have the money for the support services, then yeah, you have recidivism. And I'm sure you saw that a lot with people getting to a place that we could define as good and safe, and then...
Yeah, no, and I'm sure this is a big open discussion we could spend lots and lots of time on, but I think for us, we were taking care of people living on the streets from 1985 to almost 2004. No one would get into housing because they didn't get through all the stuff you had to do. They weren't on their medications or they weren't sober enough. And then all of a sudden in 2004, as you all know, these low threshold housing programs came and they became the top of the list. And all of a sudden we're getting people housed. And it was like, it was the miracle. Like we've been waiting 25 years for this. But then I think one of the things that we were interested in, Heidi knows as well, that once people got into housing, we thought, well, great, now we can get them into their, neighborhood services, et cetera. But we were stuck, and this goes to one of your principles, we were stuck if we had been taking care of people for 15 or 20 years, knew them well, they were really annoyed if we weren't going to continue to take care of them after they get in housing.
Oh, yeah.
And on our board of directors, we have some very vocal, people who are housed, and we just got told we had to keep, we couldn't abandon them.
Right.
So what we ended up having this kind of experience from 2004 on to now of taking care of those people who've been our patients for years in housing. And for some, it's been just a breeze, and for others, it's been a real struggle. And a struggle are the homeless folks on our board, several have been housed, and they've done a video talking about the kind of loneliness you have to get ready for, how all your skills that you used to have on the street don't work anymore. And you have to build a new community. And if you're all alone, it's hard to do. So, putting all that together, I think is the burden that all of the housing folks understand well. And I think we're all want to be sure we have enough money to provide those supports. And for us, kind of selfishly, it's been one of the joys of life. We get to see people where instead of under a bridge, we're seeing somebody in their own living room. It's really quite spectacular.
Yeah, I loved reading about like when you went to people's apartments and like, oh my God, this is your place? Yes, this is my place. They were so excited.
Speaking of that, one thing to remember is that this is not a housing agency. They end up having to do a lot of the work because particularly when it comes to rough sleepers, the housing agencies really don't have much of a clue, even now. Well, that's not quite fair, but
They don't have the support.
Did you hear that, Susan? We don't have.
Well, when it came to the
He didn't mean that. I'll tell you.
I didn't mean it.
It was just over there, it's just them.
I'm sorry. But what I meant to say.
Fair. No, it's fair, it's fair.
It's much more difficult than.
They're
than-
single-minded. They can be very single-minded.
It isn't, yeah. And what Jim really helped to create and is now, is really a medical organization. And medicine alone, of course, is not going to solve this problem. So they have to get involved in housing, but they don't have the resources to do all of that. As a medical organization, though, I think to share with you quickly,
Yeah.
it is extraordinary. I've never seen, I couldn't have imagined a thing like this. They're like their extent is like the extent of the subway. It's like a subway map of the city. 30 clinics, one in every shelter. They have this wonderful 104-bed respite hospital where people can go for all sorts of reasons, and also a really lovely step-down one that's about 25 beds.
24 beds.
24 beds for if you're being treated for cancer over a long period of time. They have a dental clinic where I think there are 3 dentists working, and they make hundreds of dentures every year. I mean, in the world's richest country, the rich and poor are also starkly divided by their teeth. This is really important stuff. They have a special team to help take care of transgender patients who are tremendously endangered out on the streets. They have special teams to take care of AIDS and hepatitis C. In fact, they've done so well that one of the people running has just been taken in been asked to. Tell me.
No, we have a really fabulous nurse practitioner who has been overseeing our hepatitis C team for years, and she's just been put on the national committee, that looks over hepatitis C, so which is kind of pretty
impressive.
cool.
That's great.
So, and I could go on, and then there's the street team and so on. But it is, as one friend of Jim's, who's a wonderful thinker and a doer in the business of trying to get homeless people housed, once said to me, is that, this is much more complicated than just medicine. Well, medicine is crucial. Jim's doing just what he should be doing. But until these other things get fixed, he's going to be standing at the base of a cliff trying to save people. And I think it's something we should.
It is a very complex problem, and we can't do it without our partners from Duffy and Gosnald and other medical providers as well. And it is a team. I mean, that's what this is. It's a very elaborate team that you have to be collaborative and share information and share resources.
Right. No, I couldn't agree more. And that's been sort of one of the other joys for us is, when you grow up in medicine, you sort of know medicine and think it like that, but you don't know anything about housing. And my suspect is my friends who are in housing say they learn a lot about housing, but they have no clue what we're talking about. So trying to blend those two very different cultures, I think, is a real challenge. But the joys of doing that and is really wonderful. And I would just say, and when Tracy was saying that before, I think what we all learned was if we've known somebody for 20 years on the streets and they go into housing, if a case manager then picks them up at that point, the knowledge of that 20 years is really hard for that person to pick up. So that's the times when the collaboration is really key.
The warm handoff
and that's
and
where
the
you have to be sure, so we've learned that if somebody's been housed for 10 years and they're coming back to the streets, we want that housing worker to be with us to teach us how to take care of them.
Imagine if this model were adopted by American medicine more generally. I mean, right now, what's the state? The typical thing in American medicine is corporate takeover, medicine for profit, time-limited, distracted doctoring. It's pretty terrible, and a lot of doctors hate it, and a lot of patients hate it.
Even ones who are housed.
Yes,
Yeah.
that's true.
Just to be clear.
But think about some of the principles. You wouldn't want to copy everything, of course. They have to spend a great deal of time with their patients, typically. And you probably wouldn't in a regular practice, but you would want to practice continuity of care, which is so important. And it's what we're talking about with this system. To be just shuffled off to another doctor every time you turn around. I mean, it's continuity of care, taking what time is needed for a patient. I mean, we need to, and I think with this, what Jim, maybe you could say a little more about that, how you could.
Yeah, no, I think what we learned the hard way that when we came and tried to take care of a homeless population living in the shelters, and I'll never forget getting to Pine Street, there were 800 people living in the shelter. And I was coming from the hospital, and I knew nothing about homelessness. And what we realized is that to take care of those, and this is if there are nurses here, this is all learning I got from nurses, that unless we were able to earn their trust, take time to get them to trust us, they weren't going to do anything. So all the prescriptions I'd write, all the advice I'd give were useless. And so we learned that 10 minutes or 15 minutes we used to have in the hospital didn't translate into taking care of this population. And I've often said to Tracy that if you, and all of you know this, I'm preaching to the choir here, but if you're going to reach out and try to take care of a very ill and complicated homeless population, they will show you the weaknesses in our healthcare system right away. And I think what we learned is we had to, I say we learned, we were told by the homeless people that put us together, we had to stay part of the hospital because when they got sick, they wanted somebody that knew them when they were in the hospital. But we then had to go out and do clinics wherever they were. You had to go to them, which is an unusual, we're used to making sure people come to us. But that has been the secret. I think Healthcare for the Homeless programs, Duffy Health, we've all learned this over the years. But it's not common in the American medical system. And I worry a lot for people that are struggling with so many other burdens, housing burdens, or all of the stuff, poverty, racism, all that. Unless we can go to them and understand what's going on, it's going to be really hard to have a continuous care system that takes care of it.
Yeah, I mean, we see that in our work as well, is that connection between primary care, even in someone who is stably housed. The sooner we can get to them and help that patient through that trying situation, losing their job, losing income, loss of spouse, the easier it is to keep them housed. And so that connection, I think, hopefully we'll see more of over time. Before we invite our other speakers up, though, I do want to go back to you, Dr. Jim, and you went to Harvard, right, medical school. This wasn't your dream, and here we are having built like state-of-the-art evidence-based programming that we're all modeling and looking to. Talk me through kind of the shift and evolution of your thinking and of your career. When you were in med school thinking I was going to be this hotshot doctor because you got into Harvard, and now here you are working with homeless and still a hotshot to us, but talk us through that your evolution of yourself and your thinking and your career.
I was just thinking as you were talking, and I'm glad my wife isn't here to hear that. So. I think for me, I didn't get to medical school until I was already 30 years old. So I was, as my mother used to say, I was a very delayed vocation. When I got there, I was just thrilled to be a doctor. Thrilled that I knew what I wanted to do. Here it was. And I actually, strangely, really loved medical school. It was really kind of fun. I finally was learning something I wanted to know. And then when I got to the hospital, to train at Mass General, it was like medicine was spectacular. It was just this unbelievably complicated but wonderful profession for me. And I wanted to become an oncologist because I was fascinated by cancer and the care of people with cancer, especially end-of-life and palliative care. And then I got told to do this job. I realized my life is full of right turns that I didn't expect. So I got told to do this job, and when I first got there, it was I wanted to go and do a year of giving back. And the reason I'm saying this is because what I didn't know was what the homeless people who put us together wanted was continuity of care. They wanted doctors and nurses and teams that just like we want, someone who's going to be there today and also be there next week if you're sick or 2 years from now and get to know you. And when they heard I was going to be there only for a year, they couldn't stand me because they said, we don't want to open up and have you get to know us and you're going to give us all whatever you're doing. And then a year from now, you're just going to leave us. So I had a real existential crisis about that because I was acting just like the person they didn't like. And so I remember struggling with that. But then what I got captured by, as all of you know, if you take care of these folks, one, it's initially how complicated everything is. When you have when you have diabetes and you're also struggling with schizophrenia and you're also caught with an addiction or substance use disorder, it's really complicated to take care of that person when they live outside or in the shelter. And I think all of us who cherish doing medicine are overwhelmed by the complexity. So I was initially caught by, this is much harder than when I was working in the ICU where I had control of everything. And I was compelled by that. But what I wasn't ready for was to realize how slowly things happened. You know, like I'm used to like give a medicine will cure somebody, will, you know, and it didn't happen like that. And I remember that's where the nurses, Barbara in particular, came to my rescue. Said, like, if she would say things like, you know, if you're looking to change people's lives and get rid of this homelessness, you're in the wrong business. You're a doctor, okay?
I love that.
You don't do that.
It's true.
And it sort of gave us, which I know is something all of you could articulate probably even better than I can. It let you know it really was about just taking care of people. It wasn't about changing society, even though we'll fight like hell to change society. The likelihood we're going to do that in the next 5 or 10 years is pretty slim. But these are sick people who need your care now. And I was stunned by how much they appreciated all of us being there, and then how strong those relationships became. And then I think that's when it all changed. That's when you realize, oh my God, this is exactly where I wanted to be, although I had no idea until I got here.
And
Is that okay?
yeah. And I think my colleagues who we're going to invite up in a minute would say the same thing. I don't think they planned on this as a career. So Patty, are we inviting people up now? Are we inviting Heidi and? Oh yeah, a couple more. Well, why don't we? They're Heidi and Susan. Why don't you guys come on up? Yeah.
Do you want to sit here? Or you want
No. Are they just coming up and yeah? Okay. Well, let's get them mic'd up then. Let's get that going. Yeah. Okay.
Is this going to be magic? You want
So
my chair?
this is Heidi Nelson. She's the CEO of Duffy. And Susan Mazzarella, she's the CEO of Catholic Social Services. They are both. Here, I can come back here. They are both good colleagues and friends and partners in this work. And I wanted to invite them to kind of speak a little bit about their work and what they do, and also have an opportunity to talk to Dr. Jim and Tracy Kidder. And I want to make sure we leave time for my outreach team to come up. Okay. So, Heidi, I was going to like go right to you and just talk about. So our 3 agencies work very closely together on homeless outreach, on sheltering, on housing, on permanent supportive housing. We have many grants together, programs together, share clients, share employees. We have a lot of overlap and interconnectivity. And I wanted to throw it to Heidi first of all, because she has, as you heard, is a good colleague of Dr. Jim's and has been in this business for a long time, but runs a fabulous organization, does important work, and we have a lot of really exciting things happening that I wanted you to share.
And I'm so happy to do that. Hi, everybody. And because we're in Falmouth, I think it's important to acknowledge our colleague Gina Torrielli, who leads. And Alisa DeGroot is here too from Belonging to Each Other, our Falmouth colleagues. Thank you. So I am one of those flawed human beings that loves to push the rock up the hill. It's all part of the journey. Duffy Health Center is a healthcare for the homeless program. Our mission is to improve the quality of life for people who are homeless through healthcare. We serve about 3,000 people a year in Barnstable County. So just think about that. That many people now. Comparing to Boston, where there are many, many more homeless who are unsheltered, right, or out, very visibly out on the street in the shelters, the vast majority of our patients are people who are unstably housed, as you all know, really hidden homeless. People struggle with housing and homelessness, but we don't see it as blatantly as you might when you're walking down the street in Boston. I think one of the other things I want to say about our model that was sort of implied is that part of what we do that is unique through healthcare for the homeless is integration of services. So in addition to the primary medical care services, having mental health on the team, having substance use disorder folks on the team, it all is and healthcare for the homeless has been that way since the beginning, as compared to regular medical care, which is starting to move more, much more in that direction. What I wanted to talk about is, as Alisa said, some of the evolution of our programs. We are the lead agency, Duffy is the lead agency for a program called In From the Streets, which for 15 years is a collaboration of all the organizations serving the homeless on the Cape. And we were a sleepy little program for many years. We served anywhere from 40 to 60 people a year, $60,000. We'd get a grant from the United Way. The towns would kick in. Well, then 3 years ago, COVID hit. And the value of what we do skyrocketed as far as our county officials, our town officials. So the fact that we had a motel stay program that sheltered people. Well, where did people need to be during COVID for quarantine? They couldn't stay at the shelter. The shelter had to shut their doors to new intakes, understandably, because of the pandemic. So we put our motel stay program on steroids, and we were doing showers in the parking lot, all kinds of heroics during the pandemic. The only reason I bring that up is because all the good stuff that we did, the value of that was demonstrated. And so now our In From the Streets program is funded from the Commonwealth of Massachusetts for $400,000 a year. And for the past 2 years, we've sheltered over 150 people over the wintertime through that program. We've also just been awarded a demonstration project from the Commonwealth, which is to start our very own medical respite program. So the Barbara McGinnis House, which is talked about in the book, and Tracy talked about it, is the granddaddy of them all, really, 104 beds, almost like being in a nursing home. Our program is more modest than that, but we will be using our motel stay program, and through the grant from the state, we'll be providing wraparound medical services for the individuals who are in that program. Another thing that sprung from COVID is our REACH van. Our Duffy staff are here. Danny and Melissa, I can't see you. There they are, over in the corner there. Brought the van down through the tiny little streets of Woods Hole. It's over in the parking lot over here. Again, learning that showers and what people really need are to get those basic needs met. So a pair of socks, taking a shower. Oh, can I ask you about this? Can I ask you about that? Let me give you a referral to treatment. But the big news for the three of us, the three sisters in homeless services, is that we are working diligently. Alisa, as our housing organization here on the Cape Affordable Housing, is taking the lead on identifying a new location for our individual homeless shelter on the Cape. So we've known for years that to be a block off of the biggest tourist attraction on Cape Cod is not the right place for the homeless shelter to be. So Alisa is working actively to find a new location. Catholic Charities will be operating that shelter, and we'll turn it over to Susan in a minute. And Duffy Health Center will have a clinic embedded in that shelter, and our respite program, medical respite beds, will be embedded in that shelter program. So we're very excited to work together to make that happen. So with that, I'm just going to turn it over to Susan.
To Susan, yeah.
Thank you, Heidi. I'm a little starstruck. I am. I didn't read the book, but I listened to it on audio. So hearing your voice, and it just brings it to a whole different level because you get to feel the emotion. And so thank you for that. One of the things that I really loved about your book was it beckons us closer to those individuals that are so easily put in the category of the homeless. Let's come a little closer and look a little deeper. And you'll see that these are friends and siblings and cousins and neighbors who are struggling with the common denominator, which is poverty, and also other issues that have affected their ability to stay housed and remain housed. At Catholic Charities, we operate the St. Joseph's Shelter in Hyannis, and we have 45 individuals there, and it has been packed every night for years, particularly since COVID. Just in the past year, we've serviced 268 individuals, and oftentimes people think, well, they're coming from Boston, they're coming from New York, we don't have the homeless here. Well, I crunched some numbers, and 94% of those individuals are from the Cape. Again, punctuating the point of these are us. They're part of our community, and we have to welcome them and include them as such. I'm very excited about the project that we're doing collaboratively with the Housing Assistance Corporation and with Duffy, because this partnership has been invigorating, it has been inspiring, because sometimes running the shelter is discouraging. It's pushing the rock, it's Sisyphus. So the shelters are funded by the state, and there is the scope of services. And the scope of services basically says you need to stay open at night, have people in, and then they need to be gone every morning by 7:30. Well, where do they go? They go back out on the streets. That's the model. So it really does point to some significant flaws in our system. It requires an entire reform. I'm grateful that two of our legislators are here because they're very, very interested in the work that we do with our homeless individuals. And hopefully they could help us push that rock uphill so we can be able to provide additional resources. But Heidi mentioned COVID, and I think that pandemic is what brought us together. Now, Catholic Charities, we run other shelters too in other cities. We service the entire Diocese of Fall River, so we have a few shelters in New Bedford and in Taunton. And during the pandemic, what was so interesting was how isolated we were from the community in terms of working with our shelter guests. Nobody knocked at the door. No case manager showed up for work, except in the Hyannis shelter. We had Duffy there doing testing. When the vaccines came about, they had vaccine clinics on site. And it really, they gave us advice of how we need to shelter in place, run the shelter, do social distancing, all of that, long before the state came out with their guidelines. So that just put me in awe of Heidi, and with such gratitude for the work that you do, and helping us in being able to take care of our individuals. So, again, I thank you. I'm gonna stop there because I could go on and on and on.
Just to punctuate, it's about constant problem solving and teamwork and community partners, right, Dr. Jim? I mean, like going back to what, it's not one agency, it's not one person, it's really all of us together.
It's the only way to support people and to push this rock.
Yes, keep pushing
Many
the rock.
hands gives more strength, some momentum, and I think together we could make some significant change and impact people's lives.
So before we open up to, thank you, Stephen. I'm done. I'm getting the signal of time. Like, okay, so I'm like Russia. Rah, rah. So, but before we move to questions, I do want to ask Patty and Stefan to just come up really quickly because these are.
Probably up in the a little bit more.
Okay.
I don't know that.
No, you can wherever you want. Yeah, sit down, Patty. She's very flexible. But I wanted to put a face to Dr. Jim's point of like the people who are riding in the van and on the streets and doing the hard work and every day keep showing up for work, working with some of the most challenging cases and situations. I wanted to highlight you and spotlight you and feature you and let everybody. These people are awesome. We have some. Where's the rest of the team? I can't see them in the audience, but they're here. Where are they? Oh, there they are! So we're going to open it to questions, and I want to give you guys an opportunity to ask Dr. Jim or Tracy a question if you want to. But I want to ask you guys one question real quick. What keeps you coming to work? What gets you up in the morning to come in? Look, they're all coming up. That's great. Hi. Hi, Tim. Hi, Christine. Great. Yeah.
I would say that it's mostly because I have no clue what my day is going to look like.
You like chaos.
I like the unknown. I really do that.
Yeah.
And I could tell that it was a funny day today, but I had a plan. My wife asked me when I left home, "What you going to do today?" I said, just a couple of meetings, and we're going to have this presentation tonight. So we had the meeting, and then we got a call. A woman was unsheltered. And we were supposed to meet her at the Falmouth Human Services, for those who know where that is. And she didn't show up, so we had to find her. So we took the hack van, the hack mobile, and we drove around. We found her by the harbor, and we did an intake with John. And then we were reported that there was a tent somewhere in the woods. We took the hack mobile and we went to the woods and we were looking for this person. And then we had a referral from Duffy that this man might be sick. And so we had to, John and I went to the Walmart Plaza and we were looking for him to make sure that he was okay. So my plan was to do some paperwork today.
It'll be
Monday. It'll be there Monday. So I would say that, and in addition to that, I would say that every person is, I like the unknown, and we met this woman this morning with John. I have no idea who this person is. I have no clue about her background, her past. I have no idea who is this person. So we really walk together. We really, it's not just her and us. No, it's not like this. We walk together without knowing exactly where we go. And we have a goal, housing and referral, but we have no idea where we're going to go. And I have no clue today where we're going to go with this person.
This woman needs a little halo, by the way. She's an amazing human being.
I come to work every day because I really like pushing the rock up the hill.
Just hold it close.
It's not close enough. I just like to push the rock up the hill. And I like a different day. Every day is different, for sure. And not one of us in this room, and I'm sure not one of our clients, has ever said, geez, when I want to grow up, I want to be homeless. Not one. Mm-hmm. So it's just to get them back on their feet. And there's lots of challenge, there's mental health, there's substance abuse. Duffy's been huge for us. We work in a partnership with them. I can call Melissa or Danny, and they will meet me outside. And we meet them where they're at. And we have more homeless people than I think anyone has any idea on the
Yeah.
Cape.
Very
That's
true.
why I come to work.
Yeah, well, and we are so grateful for all of you coming to work. And when I was reading the book, I was thinking of these guys and what they do every day, and those stories and the pushing the rock and the perseverance and the acceptance. So many times Patty and I have had conversations about certain clients that we're trying to problem solve resources and access, and sometimes failure is the only outcome that's going to happen for that person, for their choices. So it's hard to stand by. It's hard to watch. And I know that you see more, probably, I don't know, failure is such a judgmental term, but we see more of choices that don't look normal to us than we see choices and outcomes that get to a housed situation. Yes?
I agree. Oh, yes, absolutely. But thank you for those stories.
Yes.
You're warming my heart here. Thank you.
Yes. So I want to open it up for questions before we lose our time. And you guys can stay up here if you would like, because maybe someone has a question for you. And Patty, are you picking the questions, or?
We have a couple back there.
I'm sorry? Okay.
Can they raise their hand?
Yeah, we've got someone right here in the front. Hi.
Hi. I was wondering what you thought of forced treatment for people with severe mental illness who have anosognosia and won't get treatment on their own, even if it's offered.
I'm going to go to Heidi or Dr. Jim on that. Doctor, yeah, I mean.
You good? I think a lot about it. And it's kind of confusing. In general, we don't believe that forced treatment ever works. However, if we're really honest with ourselves, some of the people that have done the best have been those who, for some circumstance, got on medication and then did really well when they got treatment afterwards. So I don't know, I can't remember if this is in the book, but I'll tell you what keeps me up at night. So one lady that we used to know on the street, absolutely wild, psychotic, but always controlled. She used to keep everybody away. She slept on a stoop, kept everybody away by all these things. And on the van, the van that we are is not a medical van. Brings soup, sandwiches, blankets, and stuff like that. So our goal was to get her to accept some blankets. She'd been out there for years, or accept some food. And it took us about 3 or 4 years before she finally, instead of growling at us, would take stuff. And we were thrilled. And then frame shift a little bit, she became very psychotic and angry one day and yelled at some passersby, and the police took her in against her will. We lost her. And about 3 years after that, I'm at a meeting down on the South Shore, and I'm at a shelter. There was a meeting in a shelter, and there she was, all dressed up, doing really well. She was on the board. She was a consumer on the board of the thing. And I went up, but this was a lesson, so I went up to her and I said, "Oh my God, you look great. It's so good to see you." And she looked at me and she said, I can't say exactly what she said, but basically, she said, "You bastard, you left me out there for 10 years and did nothing for me." And I still torture that. So there are people out there who are really, whose the injury to their brain or the disease they're going through might benefit from treatment. So how do you measure that? And I think what we all have to do is just accept it's a complicated problem. And I don't think, what they want. We will occasionally now, when we all know someone and can set up treatment on the other end, do that if we think someone's in real danger. But it's complicated.
One
Yeah,
thing,
go ahead.
it's unconscionable to do it if you're not going to supply treatment on the other end. Absolutely unconscionable.
Yeah. Absolutely. Hi.
I'm struck by all of you being here. Thank you very much for this presentation. It's terrific. My question really has to do, and I'll start with Dr. Jim, experiences with youthful homeless, and are there strategies so that if you are working with youth, they become less or maybe not chronic homeless? I
have 2 ways of answering that really quickly. One is in Boston, we're blessed. There is a a really amazing organization, been going for 40 years, named Bridge Over Troubled Waters. And their dedication is to the adolescent and youth runaways up until about 21. And so traditionally our shelters in Boston, and we shelter about, I guess there's about 4,000 shelter beds in Boston right now. And people under 21 go to Bridge. They don't come into the shelter with the thought being, let's keep them away from that. And Bridge does a remarkable job in an often difficult situation. That's one. The other thing I think about that in this is that I think when we look at people on the streets of Boston anyway, who have been there chronically, you know, the injuries they suffered as children, you know, abuse of all kinds, emotional, physical, sexual, but also their inability to have their learning disabilities recognized in a blighted school system, or their ADD never recognized. Those people end up on the streets with no skills, 25% of our folks can't read or write. And you realize that could be prevented if we had had the services back when they really needed them, probably. So I think of the youth in that same thing. Yes, that's the time you really want to get to people and get them the services.
I want to just interrupt and let Heidi answer here.
Yeah, you'll be glad to know that our county was awarded last year a grant from HUD. It's called Youth Homeless Demonstration Project. And we got it on the first try. That never happens. Usually jurisdictions have to apply over and over and over again to get the funding. Housing assistance has been a real star and a real leader in working with the youth in the community. Homeless Prevention Council in Orleans, also a real leader, and our staff at Duffy are involved as well. So we have a youth council now that are providing input into what they see as the services that should be provided. And just this last week, we elected a youth to our regional network executive committee because of that program. So we're real excited about that.
Thank you.
Yeah, hi, this question is for Dr. Jim. Mass and Cass has been an intractable problem in Boston for many years now. There seems to be a solution available in reopening the Long Island shelter, but it's not happening, and the city of Quincy is fighting it tooth and nail. How can the city fix that? I mean, I think that's an example of, you know, the solutions are in front of us sometimes, but the political will isn't, and I wonder what your perspective is on that.
Boy, you're hitting a nerve here. This is, what I would say is, first of all, Mass and Cass is a very, very complicated issue that's much bigger than a homeless problem. It's it's several things going on. But what we've learned, just to put it in perspective, there's about 200 to 300 people that are in these camps around in Mass and Cass. We have about 6,000 or 7,000 homeless people each night in Boston. So it's a tiny percentage of the homeless population. My worry, which is not an answer to your question, my worry is that Mass and Cass is so visible, it's become highly political, it's all we talk about, and I worry about all the other issues going on that we're not talking about right now because of that concentration. Now that said, we're devastated. We used to have 7 different clinics on Long Island. It was amazing, the place. When the bridge came down, the bridge was impassable. It was devastating for Boston. So it was essentially 900 homeless people off the island and downtown, and then we had to figure out what to do. And nothing has really come back to this day. The bridge now, Boston has finally gotten permission to sort of do the bridge. It's one more protest by Quincy, because the bridge goes from Quincy back into Boston. So it's one of those, it's 2 jurisdictions. And that's the problem. The problem is it's 2 municipal jurisdictions not being able to come together on a solution. And anything Boston wants to do or anything Quincy wants to do doesn't matter until they agree. So we feel particularly frustrated by that. And in the meantime, the mayor is working hard on Mass and Cass, so I could go over that. But it's, they've tried all sorts of solutions. Interestingly, they've been more complicated than anyone knew. And the first one, which looked like it succeeded by housing everybody, it turns out during the day, everyone comes back, because that's their community. And then the question is, how do you provide a different community in a different setting? And that's the current challenge.
I think that's a challenge for all of us, where we move people into housing and then they go back to their community and their friends, yeah. And then is it a police activity, or how are you trying to manage the population then? So on a smaller scale, it's similar here.
Quick question, a comment first. Mother Teresa famously said, we can't do great things. We can just only do little things with great love. And I think what I took from reading your book, Tracy, and also Dr. Jim's life, if I had an adjective, I would say that it was self-effacing, that the book was, again, not about Jim as much as about the individuals, the rough sleepers. Of course, we've all read Mountains Beyond Mountains, and I was expecting, really learning a lot more about Jim. And I think that's really, really quite amazing, the whole issue of focusing on humanity and compassion. My question is to Jim, Dr. Jim, is how do you keep this issue of sustainability of support? We said that home, getting homes is necessary condition, and support is a necessary but not sufficient condition. How do you keep that sustainable in terms of medical staff, whether it's physicians, nurses, other medical professionals? I know you've inspired many, but how do you keep that sustained because of the, I guess, negative incentives for folks to do this in terms of salaries, et cetera, et cetera, et cetera?
I have to let everybody know this question's coming from a real hero and mentor of mine, so I've got to be careful how I answer. You know what I would say? A couple things. I know when we first started, and I think this was true of all of us starting back in the 80s, there was no easy career path and no sustainability, so that people did what I do. You do it for 3 months or 6 months or a year, then you go on and do your thing. And I think we learned from homeless people, I think, really, that they were looking for how do you make this a career? How do you make this some sort of sustainable career? And that's been the challenge. And I'd say now, we have as many, we have 30 doctors in our program working now, and probably 40 nurse practitioners and PAs in our program, and then a ton of nurses. And if there's something sustainable about it, it's several things. One, it's the work is really complicated and really challenging. And when you do it in teams where doctors and nurses and nurse practitioners can work together kind of equally, then the work is more joyful than it is tedious. And then the real issue becomes, how do you deal with just the tragedies that happen before you every day? You get really close to people, they die, or they're disappearing, you don't know where they are. And I think that's where we then have had to sustain ourselves. And then the last thing I'd say for us, we live in a world surrounded by academic medical centers, as you know. And when people get sick, they end up in the hospital. So for us, sustaining our clinical staff, and this is just for those of you thinking clinically, has been very much being able to be part of the community health centers, but also take care of people in the hospitals and be accepted by the hospitals, so that we're colleagues with our, our brother and sister doctors and nurses and stuff. And I think that is surprising. So when our docs can attend on the wards, teach at the medical school, have residents and people come out, then it becomes kind of a sustainable, but unfortunately incredibly low-paying job. And I think that's the next challenge. Tracy may have more to say about that.
Just one thing about that. Again, what I was saying about corporate medicine, about the invasion of medicine by private equity. But, sorry. Lots of hotshot young doctors want to go to work for what's called the program because they get to be the kind of doctors they dreamed of being when they went to medical school. And I think that's true of the nurses too, at least the ones that I know.
And really helping people and not like on the...
Not on the time clock.
On the time clock. We have similar challenges in our...
Workforce. I want to talk about where we've come, and I want to point out Joanne Ford. Where did Joanne, there she is, a nurse working with us, who worked for Cape Cod Healthcare for 30 years. How many years did you work there? As a nurse, and now is coming to work at Duffy because she's loved us from afar, and now she wants to be a part of our team. So looking at people who want to capstone their career, but also mixing in new idealistic people who are just coming out of their programs and pairing them and mentoring them with people who have been doing the work for years. We're sort of hitting on that as the right formula for how we're staffing our program.
Thank you,
I
Heidi.
have a question back here, sorry. In 1997, I had the privilege of having the free time to be able to volunteer for School on Wheels. Have you all heard of School on Wheels? It was founded in the late 80s by Agnes Nixon. It took her 4 years, she likes to tell the story, to convince the county of Santa Monica that they actually had homeless children. She kept showing up and saying, look at your population. And they said they were only adults that were homeless, no children, which of course was a big fat lie. So I was fortunate enough to have Kizzy Frisbee when she was 5 years old and just starting kindergarten. She and her mother and her 2 siblings had just been placed in a shelter on the west side of LA that was very progressive at the time. They actually allowed families to stay together and not send the children to services and keep the mother someplace else, which, as a lot of these shelters, as you mentioned, get out by 7:30, they're punishing. And I really, really hope that everyone understands that, anyone could end up homeless. You could have a head injury and leave it can happen to anyone. And I was also, my question really was, have you ever worked with School on Wheels here in this area?
Thank you for bringing up School on Wheels. We actually do not utilize School on Wheels in Hyannis because we run the individual shelter, not the family shelter. However, we have family shelters all throughout Bristol County, and we've been partnering with School on Wheels for over 10 years, and they are extraordinary because they work with the children and the parents in the shelter system. They provide resources like backpacks, back to school things, but most importantly, when you have children that are in shelters and they're bounced from unstable housing to shelters and back again, their education becomes tragically splintered. And School on Wheels understands that and works to smooth out that splintering and fill in some gaps. So School on Wheels is wonderful. Thank you so much for bringing it up and for what you've done in that agency.
Hi.
First of all, I want to welcome Tracy Kidder back to Falmouth. You were a choice of the West Falmouth Reading Program when you came, I think about 15, 18 years ago. So thank you for coming back. This was Mountains on Mountains that we had chosen as a community to read. I have one quick comment. I don't know what shelters look like when they are built, but I hope you put porches on them because it's a good gathering space for people to alleviate the loneliness issue. My question is, I have a personal, not for me personally, but a burning urge to try and find out, the housing spectrum goes from the homeless to the Charles area that, you've got a lot of people of wealth. In between, there are sober houses. And on the Cape, we have an innumerable number of sober houses. Hardly any of them are regulated. So it's a housing situation. You have people in with no regulation to provide the services that they need. So I don't know where sober housing fits in to the, I know you guys are working on the tough stuff, the homeless, but what can we do as a community, as a county, with sober houses to get them more regulated? The MASH, Mass Association of Sober Houses, that needs to be pushed. And I'm not sure, I've talked to to our local district attorney, our new sheriff, our representatives, and everybody kind of does this.
Well, it's very complicated because you're talking about fair housing issues and the legality of monitoring somebody who's living in a house and how they're behaving is outside really the jurisdiction of our bylaws in a town. So we should probably take it offline, but it's more complicated than just regulating sober houses because you're talking about people with disabilities, people who have a right to live in a home, and there's no real regulations or rules around how people, whether they're in a sober home or not in a sober home, live, right? We don't go to other people's homes and say you can live like that or not live like that and you got to leave because it doesn't look a way that we want it to look. So I know it's complicated, I know it's frustrating, but it's really more about the support services and the social services that we need to be providing people and the failure of the healthcare system.
One suggestion that was in the book that I loved, I thought it was the best suggestion in the whole book, because it gets to the root of the problem, which is children. And if these people had help as children, they might not end up in the situations they are now. And the suggestion was to pay teachers much more.
Yeah. $200,000 a year. All right, we've got two more questions.
We have two more, and then unfortunately we have to stop after these two last
Ann
comments.
Schiffenhaus. Yep. Hi.
I assume that you track folks who have passed through a homeless shelter, and I was just wondering how often you come across what might be called a success story of people who get squared away, can live independently so that they avoid the circumstances that put them in a shelter in the first place.
So we're defining success as, just so I'm clear, so they can answer the question, you're defining success by being stably housed long-term?
Well, success in the sense of getting their lives in such a situation that they don't need to go back to the shelter.
That's a tough, yes, Elise.
I think you got on talk about an organization that's in Falmouth that does sheltering in the winter for people who are homeless. And we have various types of sheltering. We help people with our case managers who are up there, helping to find long-term stable housing. And we've got 75%. It's belonging to each other here in Falmouth. So if you want to know more about it, MBL.org. Love talks about it.
But to long-term, it would be great.
Hi, can you hear me?
I don't know, Heidi or Dr. Jim or Susan, do you want to take on long-term success?
Wanted to say one thing to Dr. Jim.
Yeah.
Jim, you and I met 37 years ago. I was a medical student. A good friend of yours, Eileen Riley, was at our wedding, and I just spoke with Eileen today. A lot of us have put our toes in the water in our careers, physician for 34 years now. You jumped into the ocean. 37 plus years ago, there was no life, so thank you for not drowning.
Thank you. I didn't hear that.
Still an inspiration 37 years ago to me and many people. Thank you.
Okay.
Can I say something about this?
Yes.
I got accustomed to being told that Jim was a saint. And when I think about this, it suggests, of course, that this work is work only that only a person specially designated by God would perform. You think about it. Here's a guy who spent a long time trying to figure out what he wanted to do with his life. He figured it out. It was medicine. He worked his tail off. He got really good at it. And then, even though he wasn't willing at first, he got to have as his patients the people who needed a good doctor the most in the whole city, in the whole state probably. And he's able to work for them and at the same time to be rewarded with enormous gratitude. It sounds like a pretty good job to me.
So true. All right. Our last question.
Hi, so I have a question more on the program side of things, which is how do we inspire the next generation? I've been fortunate enough to work with Homeless Prevention Council for the past 4 or 5 years. I know that we have a case manager here and that we have our CFO is here as well, who's my mother. But my question is, how do we inspire the next generation to continue the work that we're putting in place today?
Continue the work that we're putting in place today. That's Dr. Jim.
You know what, I'm just going to answer that because I think that is, how do we inspire the next generation, people coming up to do this kind of work the way all of you are doing?
I just have, the first comment I have is, I would say half of our staff do what they do because they read Mountains Beyond Mountains. And I suspect our job is to tell the stories, as Tracy has, of what our work is like taking care of homeless people, to inspire people to do that. That's just one way. Then the rest is, I'm going to leave up to everybody else to say, but we got to figure a way to do it.
So outreach team, what do you think? How do you inspire the next generation? I'll just throw it to you before we close.
I was talking about Youth Street Reach. It started in Hyannis, and the kids from the school, I think once a month, go to the church on Main Street and serve breakfast. I met this little kid, Sebastian is his name, and he was really a tiny little thing. And he said, if we do this in Hyannis, why don't we do this in Falmouth? So it started here. Is it First Federated? Yeah, Federated? Yeah. Mm-hmm. So it started at the Federated Church. So this is how you bring the next generation to be involved, not to be afraid of people, to serve them breakfast, help them find the clothes they need. So I think it's a wonderful example of what can be done, and it's being done today in Hyannis and in Falmouth.
So, wrapping up, we heard that homelessness and housing is really the critical failure of many systems, right? Education, healthcare, it's a mental health failure, it's a housing policy failure. There's a lot of failures, systemic failures. There was a line in the book that I'm just going to leave everybody with, because this is what we do while we wait for the world to change. We're going to keep on keeping on doing our thing while everybody else gets their act together. So thank you very much.
She's pretty well, isn't she?
Thank you.
She always that way, and she's such a good person.
Just an announcement for those who took the shuttle. They are out front waiting, ready to bring you back to the lot. Maybe have people go to the front and say it at the front. Just an announcement for anyone who took the shuttle.